Hi, this is a video specifically for neurodegeneration in Parkinson's patients. But again, I want to classify that, whether you have tremors, Parkinson's, Lou Gehrig's disease, multiple sclerosis, ALS, even neuropsychiatric issues, which could be depression, anxiety, bipolar, you should be listening to what I'm saying here. There's a bunch of research, and I started to plug in information into PubMed, looking at a process called methylation. And methylation is a process inside the body. It's the #1 most studied epigenetic process, biochemical process inside our brain and our body. And it's essential in everything working properly. And assume that water is a H2O and a methyl group is a CH3. So assume this red pen is a methyl group. You need billions of these to work properly. Without these, things just don't work. And there's a whole process that your body goes through to produce the methyl group so that everything can work. But it's interesting, one of the things that we started to look at here as I went through this and looking through PubMed at the basic research was the idea of neurotoxicity in Parkinson's patients when you're a poor methylator. And I said, wow, that's kind of interesting. And so what they were able to show is that when you're a poor methylator, one of the things that will go up on your blood work sometimes is something called homocysteine. There's also other indicators that I see on blood work that can show that you're a poor methylator. But when you're a poor methylator, basically what that means, again, you don't have enough of these. And what happens over a time frame, we've definitely found that there's a connection between the accelerated damage inside the brain, specifically of the dopamine cells, through neurotoxic effects. What that means basically is that when you don't have enough of this, your level of homocysteine goes up and it becomes neurotoxic. And this may be one of the reasons why we're seeing these signs of neurodegeneration. Also, because methylation is involved with many different things, it's also involved in detoxification. And one of the reasons why when you take some of the drugs or medications, whether that's for specifically Parkinson's or any other psychotropic drug, while we may see the brain get worse, is because we already know that you're a poor methylator and that the brain can become toxic from the high levels of the homocysteine. Well, if we have not addressed that problem, and now you take a drug that you're going to have to detoxify, you're going to put more stress on your already low levels of methylation, which means the brain can break down fast. And this may be why someone that gets on the Parkinson's medication sees a pretty rapid decline and major increase in symptoms in a short time frame, because we're not looking at the root functional cause. The person is already a poor methylator for various different reasons. They're now having the neurotoxic effects of the high homocysteine related to the poor methylation. And now we throw a drug in. And when we throw the drug in, we're going to require more methylation to break the drug down. And now we see the brain get worse. So it's an interesting idea, but this may be one of the main mechanisms as to why someone sees a major increase in neurodegeneration by taking the medications. It also would make sense to me that if you are going to use one of the medications because it helps you with your symptoms, that you want to get this checked to say, hey, am I a good methylator? And make sure that you're supporting this so that you can actually detoxify the medication and not get long-term side effects or get the minimal side effects you possibly can get. So again, I hope you found this interesting and informative. And if you have any questions, please let us know. Thank you.